Hi, my name is Sue McCarthy Robinson. And in this video today, I'm going to reflect on, emotional intelligence and the self-assessment results from the tests that I took and discuss areas for improvement. I'm going to outline my plan to enhance my EI skills. Um, I'll address challenges I have encountered in recognizing EI in others and how I plan to navigate these challenges in my professional practice as a psychiatric nurse practitioner. So the summary of my EI self-assessment, after completing the assessment, I received, an overall percentage score reflecting, my strengths and growth areas. My most substantial domain was empathy, which indicates that I can relate to and understand the perspectives, emotions, and motivations of others. This strength is, essential in my role as a psych nurse practitioner, where patient-centered care requires, active listening and compassionate understanding. However, the weakest domain of self-control that I have requires, I need some improvement there, and I realize that, was really not any surprise to me. While I manage my emotions well, in my practice, I sometimes struggle to regulate my stress. It's something that I try to manage on a day-to-day basis, um, while managing, multiple responsibilities. This realization is critical because as a healthcare provider, maintaining emotional stability is necessary for effective patient care and decision making, especially, when I am a provider of some of the patients that are unstable, unstable in their mental health. So identifying a plan to improve my EI, to enhance my EI, I've created a structure plan, focusing on self-awareness, self-regulation, and continuous learning. The self-awareness development. Regularly self-reflect and journal to recognize emotional triggers and reaction patterns. Just like I put in a lot of the plans, for my patients. Mindfulness and stress management, I plan to incorporate mindfulness techniques such as deep breathing, meditation, progressive muscle relaxation to improve self-control, reduce stress so that I can be, the best provider I can be. Not addressing stress can adversely affect my well-being and then adversely affect, the care that I can provide to my patients. So enhancing empathy through active listening. While empathy is my strength, I will continue to refine my skills by practicing more profound active listening and perspective taking exercises. Seeking feedback and professional development, I will solicit feedback from colleagues, mentors, and supervisors to gain insights into my EI strengths and areas for growth. Engage in continuous learning. I'll explore literature on emotional intelligence and attend professional development workshops related to EI in clinical practice. So which principle is priority for EI improvement or development? So, among the 4 EI principles, self-control is my priority for development. Improving my ability to regulate emotions, manage stress, and remain focused in high pressure situations will benefit my professional and personal life to avoid burnout. It's easy to get there, if something isn't done, to prevent it. So in psychiatric care, where emotionally charged situations are every day, maintaining composure, and focus is essential to providing optimal patient care. So sharing the challenge that I've experienced with understanding or recognizing EI in people that I work with. So one of the challenges I faced in understanding EI in colleagues and patients is identifying when emotional intelligence is lacking, especially when someone's struggling to regulate their emotions. So when I'm, meeting with a patient that is quite unstable with their mental health, for instance, someone that may not express their feelings openly, maybe making an assessment of their emotional awareness or distress difficulty. Additionally, I've observed in high-stress environments such as psychiatric settings, professionals may become emotionally detached as a coping mechanism. So the patients may become detached, the staff themselves may become detached, which can sometimes hinder effective patient-provider relationships. You know, we as providers, we're not perfect, so we can become detached. So recognizing these patterns and addressing them constructively is an ongoing challenge. So how will I address these challenges? So I have to improve my observational skills, paying close attention to the verbal, the nonverbal cues. I can better assess the emotional states of colleagues and patients, foster that open communication, encouraging, the workplace discussions about emotions and well-being can help create supportive environment where colleagues feel comfortable expressing themselves. It's okay to say, I'm not okay. There's nothing negative to that. We can get better, but admitting that is okay. Utilizing empathy and active engagement. Empathetic communication will help me understand colleagues and patients' perspectives and support their emotional needs. Apply EI training in team settings, advocate for emotional intelligence training in professional settings to enhance workplace dynamics, and patient care. So really in summary, self-assessment has provided valuable insights, into my strengths and areas for growth. While I excel, as I mentioned, in empathy, improving self-control remains a key focus for my professional development. By implementing strategies such as mindfulness, active listening, continuous learning, I'm committed to enhancing my EI skills. I think it's very valuable. Additionally, recognizing and addressing emotional intelligence challenges in others will require a combination of keen observation, open communication, and a commitment to fostering emotional awareness in my workplace. Thank you for listening to my reflection, and I look forward to continuing my journey with you all toward that greater emotional intelligence. Thank you.